Hey, this is Dr. Matheson Harris with Harris Eyelid and Facial Plastic Surgery in Salt Lake City, Utah. I get a lot of questions in my clinic and online about internal Browpexy. This is a procedure where we make an incision in the upper eyelids, usually together with another eyelid surgery such as blepharoplasty or ptosis repair. Through this incision, we raise the eyebrow or stabilize it with some deep sutures. These stitches are placed below the brow hairs and attach the brow to the brow bone at a slightly higher position. The sutures are deep and you'll never see them after surgery, but you likely can feel them and have some tenderness afterwards. Now, Browpexy is typically chosen in patients who either need a slight stabilization of the brow to prevent it from being pulled down when you remove a lot of skin with the upper eyelid, or in patients who need some brow lifting to open up their peripheral vision but can't hide a scar from a more traditional brow surgery. Other procedures we use to raise the brows, such as a pre-tracheal brow lift that involves making an incision along the hairline, or a direct brow lift, which involves an incision directly above the brow hairs from the outside, or even a coronal brow lift, which is an incision clear across the top of the head, all involve scars which can be visible unless they're masked by hair or very bushy eyebrows. So a lot of people, especially men who have receding hairlines or no hair, just really can't hide a scar anywhere else but in the eyelid crease. So we see a lot of men and some women who we resort to using the Browpexy mainly to get the brows in an acceptable position after eyelid surgery, but really we don't expect to see major lifting of the eyebrow with that procedure. I have patients sometimes come back and feel that they haven't gotten the amount of lift that they were expecting, and it's always a situation where we have to be sure that their expectations are clear about what the Browpexy can and can't do. We especially see some limited results with patients who have very heavy or thick eyebrows or a very heavy forehead. Trying to raise the brow and hold it in place with just some deep sutures when you're not actually removing any of the excess skin that's caused the problem in the first place is probably not going to give you the best result as far as dramatic brow lifting. So it's important to understand that the Browpexy does have a place in eyelid and facial surgery, and that is mainly to stabilize the brow and give it a small amount of lift. I would say we see on average 1/2 to 1 centimeter of lift in patients who have a normal thickness of skin in that area, whereas people with very heavy brows, we can mainly just expect the Browpexy to keep the brow from being pulled down further. If you have any other questions about Browpexy, feel free to contact our office at 801-264-4420.